Many people find herbal supplements to be safe and effective. However, it is important to understand some of the characteristics of these drugs. Most importantly, herbal supplements are categorized as food supplements, not pharmaceuticals. Thus, they do not fall under the FDA's purview, so no one regulates their manufacture. The companies that make supplements can put just about anything they want in the pills. The importance of this was illustrated in 1999 by a small study conducted by Aurora. At the time, herbal supplements were flying off the shelves due to the skyrocketing price of pharmaceuticals. They took samples of 3 different supplements from each of 3 different lots and submitted them to a reference lab to determine the makeup of the capsules. One of the lots had 95% of the stated amount of active ingredient in it, but there was a great deal of variation in this, ranging to as low as 5% in one of the samples. This is bad enough, but in my mind, what makes this worse is that we have no way of knowing what actually is in these supplements if they're not making the supplements with the ingredients they say they are. Furthermore, since there is no regulation of the final product, as is required with pharmaceuticals, there may be considerable variation in potency from lot to lot based on soil, light, water, and manufacturing conditions during the growth, harvesting, and preparation of these supplements. Secondly, and the reason why many people find herbal supplements effective for them, is that these supplements are often extracts from the plants that are the original source of some of the medications we routinely use. However, these supplements are often ground up roots or leaves or crude extracts of the plants. They may contain dozens, if not thousands, of active ingredients in addition to the major ingredient. Since there is no regulatory agency that requires the manufacturers to study these drugs, there are generally few, if any, studies done to explore interactions between the various components of the supplement, between that and other supplements that might be taken at the same time, and between these supplements and any prescription drugs you might be taking. Third, there is no regulatory agency with the authority to require supplement manufacturers to justify their claims with placebo-controlled studies. Pills have a powerful placebo effect, particularly in allergy, which is known to have a 30% placebo response rate. That means that if you give a sugar pill to allergic patients and tell them that it is the latest thing for allergies, about 3 out of 10 will come back and ask how they can buy it because it works great. You will find that the promotional literature for herbal supplements is of the testimonial type, such as Joe Blow from Timbuktu thinks this is the greatest thing since sliced bread for his allergies, and you will too. There is no scientific data, such as we have for pharmaceuticals, such as in a randomized, double-blind, placebo-controlled trial in 3,000 people with dust mite allergy, 75% of subjects had a statistically significant improvement in their symptoms with this medication as compared to placebo. Lastly, herbal supplements are made from plants and contain plant proteins. Similarly, pollens are plant proteins. There are generally no studies evaluating cross-reactivity between various supplements and the various pollen proteins, leaving open the question whether patients with pollen allergies may have either a mild or possibly even a severe reaction to the supplements. It is fairly well known that chamomile cross-reacts with ragweed, and there are likely other unknown associations that might make some of the supplements dangerous to allergic individuals. In summary, many herbal supplements are actually crude preparations of potent medications, so I'm not going to tell you not to take them. However, they should be used with extreme caution. Variations in manufacture can produce variable results. It is my understanding that Germany has pioneered this industry and generally has the most consistent products. So when looking for an herbal supplement, you might want to consider buying products that are manufactured in Germany. You should also be cautious about cross-reactions between various herbal supplements and between the supplements and any prescription medications you may be taking. Promotional claims by supplement manufacturers are not subject to any fact-checking, so you should be sure that they are actually having a noticeable and beneficial effect before you continue using them.